talking to my colleagues, my former colleagues in the institutions in the EU working both on health and on digital, I think they are all very excited that digital health may finally be better understood by the average decision maker, and that the digital and data-driven toolbox will become a normal thing. Greater understanding of the affordances of telemedicine, greater understanding of how real-world data can help to improve health.
COVID certainly highlighted the need to be able to treat and even provide preventive care remotely. There's no doubt that I expect an acceleration in terms of consumer demand and public authorities' willingness to create those conditions.
One of the main benefits of current technology is this use of real-world data to be able to deal with pandemic situations. We are able to collect more information than we never have been before, and thanks to AI, we can make more sense out of this big flow of information than we did in the past. So there's a lot of conversation today about this tracing application. It strikes me that this is going to work only if there is a common regulatory agency. So from an industry perspective, I think this different information will allow us to standardize clinical trials, which will in the long term allow us to get to solutions quicker.
There are a couple of obstacles which will be remaining after COVID and maybe even increased. The biggest obstacle to innovation in this space is trust. And if the virus tracking mobile apps are badly designed, badly rolled out, not taken up, then we will destroy trust instead of creating it. So we're at a very delicate moment in digital health innovation. Talking in my networks to general practitioners, for example, doctors out in the countryside, family doctors, they are very excited that everybody now understands that actually a bigger slice of remote connectivity is better for the patients and more efficient for the surgery. And I think that is the sort of behavioral shift that will increase the market more rapidly for almost any telemedicine play.
Any form of public health remote support would still need to fit into a broader framework, which is pretty weak. And I think COVID had the merit to show that governments need to invest much more in public health infrastructure. And therefore, we should rather think about public-private partnership in developing remote public health supports in the future. Remote public health applications could have made a difference by reassuring and by decentralizing the way in which public health treatments could be provided.
We've been trying over the years to improve the way society deals with big challenges. Trust has always been a limiting factor. Science is a way forward in a number of societal issues, but we chose to put it aside because of opinion. Today, it's no longer a question of building trust. Today, it's an emergency, a new virus, which we need to fight with all the different elements we have. And one of the elements we have is real-world evidence. So it's no longer a question of belief, it's a question of facts. And that's an amazing acceleration into the process of using new technologies, the process of using the e-health you just referred to. So for me, the future is based on an aggregation of intelligent information, and that intelligent information has to be organized in a way where it will yield useful insights which will allow us to combat that situation. And that's only possible because we suddenly have an emergency.